Shall I wait until that says go down in March?
And also some of these religious exemptions are for
Reading the,
Oh, yeah,
setting up,
absolutely.
like, or like I had a student.
You're allowed.
Oh.
Okay, guys. I'm gonna call the meeting to order. It is 7:32.
Adequate notice of this meeting pursuant to the Open Public Meetings Act was posted on the bulletin board of City Hall, on the city's webpage, distributed to the record, and filed in the office of the city clerk. Do I take roll call?
Ms. Bostic? Ms. Bostic? Here. Ms. Rubin? Here. Dr. Sadler? Yes. Dr. Solomon? Here. Mr. Tenzin?
yes.
Ms. Davis?
Yes.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, moving on to item 2, items for approval, which is the board's consent agenda. We'll bundle items 2A through 2D for approval, which includes the minutes of the February 11th, 2026 meeting, revenue of $16,845 for February 2026, expenditures of $1,275.54 for February 2026, and employee reports for February 2026. The board will need a motion and a second to approve.
Motion. Second.
Ms. Bostic? Ms. Rubin?
Yes.
Dr. Sadler?
Yes.
Dr. Solomon? Mr. Tenzer?
Yes.
Ms. Davis?
Yes.
Continuing on to item 2E, retail licenses for February 2026. Is there anything about the licenses the board should be made aware of?
No.
Even if not, we need a motion and a second to approve.
So moved. Second. Ms. Bostic?
Yes.
Ms. Rubin?
Yes.
Dr. Sadler?
Yes.
Dr. Solomon?
Yes.
Mr. Tenzer?
Yes.
Ms. Davis?
Yes.
Moving on to item 3.
Sorry. We had a question about the bats. It said there are 5 homes that had bats in Ward 1 and 2. It's like a cluster. Were they near each other? Like, what was going on there?
I didn't look at the racial distribution of them, but there were 3 in Tenafly and 1 in Leonia in the same, seems like that above Grand Avenue, that there were, and they were just the most bizarre findings of the bats too. I've never seen that before, and the only thing I could attribute it to would be the cold weather. The cold weather.
But like, do they nest? Do they travel in a group? Like, because there was a lot of reason I was going through the tunnel. It's just a lot in one place at one time.
1 month?
And then months,
Right,
right?
and then
I mean,
stop.
7, 9, 10, 13, 24.
The weirdest one was Tenafly. The woman said she, this was when it was cold, she went out for a walk. She wasn't a long walk, she came back inside, she put her jacket on the kitchen chair. And then she turned around and there was the bat on the floor. And the only thing she could think of is that the bat was on her jacket and she brought it into the house. So, but luckily she called animal control or something, they caught the bat and they sent it. Every one of those bats was treated for rabies. It's just the most bizarre thing I've ever seen.
But did you say to me, I'm trying to remember, did you say if you see a bat, don't let it out?
Correct.
That was
You
you. Okay.
never let it out. You save it so that you could test it for rabies.
I don't know how to do that, but okay, like,
You
just
just cover it with something.
cover, yeah.
Cover it.
Are these all the same species? Of subspecies of that?
And
Moving on to item 3, board liaison reports. Are there any reports tonight from any liaisons?
the personnel committee report in closed session.
And bylaws, do you want?
Yeah, I'll talk about So, right after the last meeting, Josh very efficiently revised the bylaws based on what we said, and I very non-efficiently did not get back to him. So, I did read them, I think they're fine, so how about if I just send them out as you rewrote them, everybody take a last look, and if we're good, we could put it to bed next month. Okay.
That includes, committee reports too, Stephanie.
No, this personnel at the closed session.
So we can move on to old business, item number 5, communicable disease update, Mr. Fedorko.
Hello, Brad, and hello, Josh. I didn't say hello to Brad yet. The handout is our updated report. And we talked about, last time I was here, we talked about communicable diseases. And so a big component of communicable disease and stopping its spread are vaccination rates. And in New Jersey, from previous talks, we see that the vaccination rate in New Jersey is decreasing. And there's a good website, and it goes by county. And this is an example. I chose Ocean County because Ocean County is one of the worst counties as far as vaccination rates goes. And here it has Ocean County, Bergen County, light blue. We're above New Jersey overall. And so I didn't print a copy of everybody. And it's a neat website. You could do all kind of looking at the data. And now how do they get that data? Well, they get that data from us, from the local health department, from these immunization audits that we put out. And they just combine them by county because we send all this data. So this data for Englewood is used to comprise the Bergen County. So they clump everybody in Bergen County together to get that data. So, so it just, we'll go through just quickly this chart here. So RE stands for religious exemption and ME stands for medical exemption. There's only two ways you could there are only two ways you could get out of non-vaccinated. And those are medical exemption and religious. Medical exemption is difficult because you need a physician to write the letter. Religious exemption is simply writing a letter to the school saying my son or daughter has this religious exemption. And you could also pick and choose what type of religious exemption you want. You could say, okay, we'll get the polio vaccine, but we won't get the flu shot. So when you look at these numbers, you'll see that it's like, hey, it doesn't add up. But that's the reason, because a family could say, we're going to just not get the flu shot. So here you have all the schools, and Ketsia schools, 100% good job, Ketsia. But that 100% is kind of misnomer, because 100% means they're in compliance with the law. It doesn't mean there's no medical exemptions or religious exemptions. It just means that Ketsia has, excuse me, McLeod has their paperwork right. And everything is good with the audit. So we're going through this chart here. So you see there were surveyed, 1,926 records were surveyed, and there were 116 religious exemptions and only 2 medical exemptions. So I kind of did this chicken scratch below there to show the different rates. So, and if you look at flu, so there were 71 religious exemption for flu and 2 medical exemptions for flu. So kind of gives you an idea of the flu religious exemption rate. And then MMR, which is one I'm really concerned about, because this past year we had a lot of measles cases. You see that the exemption rate is 1.9%. And then going back to the chart, so historically speaking, I think we see those numbers increasing. So there's more and more people who are choosing to get religious exemptions. And then just real fast, looking at the schools, kind of glance at, so that the schools, like the high school and the older schools, have less religious exemption, whereas Donald Coral's early elementary, they had 35 religious exemptions. So if that continues, let's imagine 10, 15 years out, and that number, you see, like right now, it's not a problem. But projecting into the future, if we don't increase our vaccination rates for things like measles, we're gonna have a lot of people who are unvaccinated. Not now, but in the future. So I always like to talk about the importance of vaccination and before the meeting, we're talking a little bit about autism. I really don't want to get into that because it's you could spend a lot of time talking about it. But I knew there was autism out there, but I looked at the rates and they just keep going up and up. If you look at the autism rate, it's skyrocketing, not skyrocketing, but it's just going up. And we were saying earlier, maybe it's due to better diagnosis, but I just can't attribute all that. It seems like it's just too much to say, well, better diagnosis.
I think it's also, doctors want to more likely give a diagnosis of autism so that the patients get services.
Oh, maybe.
Yeah.
So
So,
So maybe the autism rate isn't really going up. It's been the same, but it's just diagnosed more.
so, yeah, so I think the distinction would be severe autism versus mild, that it's all in one group.
Is it in the state of New Jersey, you're just looking at the statistics or
Oh,
looking at information?
But I don't know, I
Well,
just,
the ones I'm looking at, New Jersey, but I think those autism rates, yeah, they are national levels. I haven't seen, I don't think I specifically looked at New Jersey.
because I mean, the patients I see who are diagnosed with autism, you may not even know they have autism, like they seem pretty, mainstream in many cases, so I think the diagnosis is just very wide because they also took away Asperger's, which was like, quote, the high functioning autism, and now everything is under the same name.
And so whenever I talk to people and they know that I'm a health out, they ask me, what do you think about vaccination? And I think because they're worried, they're worried about autism and they see, you could say all the statistics you want about autism. But when your friend says, oh yeah, my son has autism because he got the vaccine, now all of a sudden it doesn't matter what all the surveys say, was now like, oh, just like if you go to get a car and all the reports say, oh, this is the best car to buy, best car to buy. But then your neighbor buys it and they said, look, this thing's a lemon. Then you're more likely to listen to a neighbor that read all those reports. And so just pointing out the difficulties that we as a board and health department have battling vaccination rates. And so the last part, though, let's move on to the other part, and that's the drug overdoses. So there we have mid-Bergens in 17 towns, and in your on here, this is just the bar graph, but here is the raw data that you got. So you could see by town, like, hey, let's see how are we doing compared to Bergenfield, you know? So you could see Bergenfields, and highlighted in yellow are females. So you could see there's fewer females that die from drug overdoses than men. And the other part that I was interesting was the average age. It's 42 years. That was from 2024. I didn't do 2025, but it seems like it's gone up. The average age of death is even higher now for drug overdoses. And I think so. Englewood had deaths in 2025, ages 34, 59 years old. The worst town was Garfield. Garfield had 8 deaths. And the range, I'll just read them quickly. 33-year-old female, 38-year-old, 39, 41, 58, 61, 71, and 73. 73.
Drug? I was gonna say, what drug?
Well, you know, and if on my report, it'll be noted if it was something unusual. Um, so, these would be, cocaine, or you'll see all kind of weird things, and then usually they're combined with alcohol. So you'll see alcohol, fentanyl, cocaine, or heroin. So yeah, I clumped them all together. If it was a drug overdose, I just put it in there. And then you could see some of the other ones that, like, Richfield Park's 67-year-old, I didn't include this, 67-year-old female death was listed as chronic prescription drug abuse. So things like that would be noted in the data.
Just ask because, as people get older, sometimes there's polypharmacy and all kinds of things going on. And drug overdose in the elderly is a problem. So, but these aren't them, I guess.
No, there's a few in there. These drugs.
So just a thought, that's why I just.
Are you talking about a contraindication of a drug or
Get
overdose?
mixed up, they might take too much of one and it, might be contradicted with the other and accidental drug
Yeah.
overdose, I guess, that's the way to say it.
Or there could be more pain. And they
Take the
have
little-
opioid over like that.
Also, so that's my report.
Narcan's statistics as to whether or not or Narcan is being used or less.
I looked at some of those numbers. And, I don't have the comprehensive report. For decrease. And I asked Tom Greeley for that report too. I asked it for last year. And I haven't seen it.
I see we're having the classes and everything, so I was just wondering.
Right, and that'd be so there are more Narcan deployments, or Narcan deployments going up, going down, right? So, I don't have such a full report. So, thank you, if you could help me remember. Tom Greeley is good about it. It's good.
Moving on to item number 6, public health events and outreach. Paula?
All right. Hello, everyone. So I'm stepping for Paula. Last week we had our annual rabies clinic. We had it at the fire department. And I want to thank the fire department for great hosts and helping us throughout the day. We had 52 dogs vaccinated and 20 cats. So we had a pretty good turnout, and I want to thank the department, all the other departments, and Flat Rock Brook for helping to promote the event. Our health educator put together a little goodie bag, one for dog, one for cats, and it had a little survey and a little poop bag and a little information about ticks and rabies. So you guys can take a look at that. Yep. So it was a good turnout despite the rain and the cold weather. Residents still have the opportunity, if they missed the clinic, to go to Englewood Cliffs veterinary PA to get their pet vaccinated. It needs a voucher. So another thing is our department recently was awarded the 2025 Healthy Town designation, and that is through the Miller's Wellness Campaign. So that
How many
is
towns get that?
2 towns.
2 towns.
Thank
Okay,
you.
Yeah, very good.
Two towns in Bergen?
No, in the state.
Yeah,
In the state? Yeah.
yeah.
Who's the other one?
I'd have to get back to you about that.
Yeah. Our first time.
Yeah, it's not a first time.
That's excellent.
Yeah, so we'll be getting a plaque and a banner shortly for that. So it's to recognize Englewood's commitment to community wellness and health. So I just want to thank the team for that. We're also going to be extending our contract with Care Plus New Jersey for another 3 months. I'll talk a little bit more about the grants in the next report, but we got a little bit more grant funding. So our health educator did 7 intakes for the month of September, for February of residents. So if you know anyone, please have them reach out to our health educator so that we can set them up with any sort of services that they may need. It can also, Englewood residents, you can also stop by the department and pick up a free radon test kit. We still have them here. 23 residents have stopped by already to pick them up. So if you want one, please stop by. And we've been working with the Environmental Commission, the mayor's office, and the city administration office to kind of get that going and raise the awareness for radon. And for the month of March, since it's Nutrition Month, we've started our annual Life Hive Nutrition Challenge, and that's for city employees and school district employees. So we have 10 city employees and a couple of several school employees working with us doing the challenge. You know, I'm a part of it. We do, you know, we meet with a nutritionist once a week. Yeah, there we go. We meet with the nutritionist once a week. We talk about our sleep habits, nutrition, exercise, water intake, that sort of thing, just to kind of try to foster better habits for the employees here. So it's been going well. And for residents, our health educator is working on the annual Spring into Wellness Challenge. So that's usually held at McKay Park. Once we have dates in the flyer, we'll put that out. But that should be out shortly. And then the last one is we're also sponsoring 2 community exercise events, and it'll be yoga and Tai Chi, and it's at Flat Rock Brook. Please, everyone, make sure to go out. We'll make sure to put out the flyer and put out the dates once we have those dates. It'll be this month on Flat Rock.
15th for Tai Chi at Lebanon.
Thank you. Yes, the 15th.
Two separate,
Yeah,
they're two separate.
two separate
Okay.
events. Yep. And Flat Rock plans to begin offering these classes on a more regular basis. So we'll be having those things, and that's also in partnership with Gym Guys, personal training. So that's my update.
Is there any update on the Tays case that we had? As to where that's going, maybe Mr. Wilson to talk about the Tays court case?
I'm sorry?
There was a Tays, T-A-S-E, Tays court date. Guess it was
For
recently.
the tobacco,
Remember, it was the business was disputing that, it was actually a tobacco product, and they wanted us to, how do we prove it was tobacco product? You remember
yeah.
that?
Yeah. Well, I'm waiting on that. We have a number of cases, underage sales to minors. Everyone's pled guilty. There's been no one who's pled not guilty and demanded a trial. So I've not had to deal with that. But my feeling is
Where was
Tampered with.
Yeah.
something about percentage of tobacco? Was it really tobacco, or I thought we had a,
if they do raise that, I would argue that it's their burden to prove that it's not tobacco.
I thought we had to find a
allowed.
lab or something to test the product, and I was just wondering what was the outcome.
I wouldn't go there. I would take the position that it's their responsibility.
Okay.
They sell us tobacco in a package that's labeled tobacco. We asked for tobacco. They sold us tobacco. It looks like a duck and it walks like a duck. It's tobacco. And if they want to plead otherwise, then my position would be that's their burden.
I guess then that ended up
Pleading guilty.
pleading guilty. And I spoke to the inspector who did that, Aisha Osmond. And, because maybe she did tell me that it went through, they paid the fine, but I'm asking her.
Okay.
Let's see what she says.
Thank you.
Yeah, I forgot about that.
Moving on to item 7, grants, Ms. Smith.
All right, so we applied for additional funding for the NJHO grant, and we got $78,964 through that grant. So we'll be using that towards extending the Care Plus New Jersey Community Care Case Management Program for another 3 months. And we're also using it for animal control, and some other department needs. So I just wanted to make sure that the board.
We'll spend the money. Because it was an issue.
No, we'll
last year,
definitely spend the
we didn't
money.
spend the money.
Yeah, I was saying that's a, nice feather in Lisa's cap. Because I didn't think that we'd get approved for the animal control contract, and she said, let's just put it in. And, Michael Kaufman, the CFO, was asking, hey, could we get the animal control contract paid? And, initially we said, no, it doesn't look like it's gonna happen, and she did it, and they approved it, so that's really good. That, they're gonna be real happy about that we're paying the animal control, and that's a big expense too. So the town's gonna really like that. So good job for putting it in, Elisa. I was skeptical.
So make sure it's in the newsletter.
Yeah.
To say what we, and where it's going and how much support the health department is helping the city.
Yeah,
Yes.
definitely want to make sure because, you're not the health educator.
And we'll
work on it, so.
We got two.
Yeah, I know. And will there be a time at the city council meeting where they'll talk about the city being identified again as a healthy city? Should that be something that we be present for?
Make note.
Yes.
That's
Well, no, I'm just saying, I'm just saying we should be identified with that. It should be out there. It's not that easy. Yeah. Absolutely. But
Maybe
yes.
when we get the plaque, they can,
Even before they get the plaque, I don't know. So the plaque comes to us or does it go to the city? You know, because does it go,
It should come to us.
where does the plaque?
Oh, well, it's a healthy town, so it goes in mail probably.
It may go to
Probably goes
the
to the
county.
If I may, since I go to city council meetings often, my recommendation is speak to Bob Hoffman, our city manager, and let him know that this award was given. Have the plaque in hand, give it to him, and let him present it to you officially during the city council meeting, which is.
But again, I don't know where,
And
who
everybody
gets the
gets to
plaque.
see it. Yeah, whenever you get your plaque, you can make that official. That's my recommendation. Get on it publicly.
I think it's a good thing.
Well, item number 8, is there any other business to discuss tonight?
Other business on our end.
Moving on to public comment, the board will require a motion to open the floor to public comment. A second and a vote. Speakers will have 5 minutes. Must state their name and address.
Ms. Bostic,
Yes.
Ms. Rubin,
yes.
Dr. Sadler,
Yes.
Dr. Solomon, Dr. Soper,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis.
Yes.
Is there any public comment tonight? Yes,
Since
sir.
you're. Steve Weinberg, I'm on Broad Avenue, Englewood. Quickie note, it's a little sad that only 23 people have picked up radon test kits. When we first announced this a long time back, I immediately went and picked up one of those. It's an easy test to administer. There's almost no work at all. I even got the result back right away. I think that one of the things that keeps people from doing that is the fact that there's no mediation that is discussed, all right? And that people have a fear of what happens if it's a positive result, meaning that there is in fact radon. That would keep people from doing it. It's so simple that as many test kits as you have should have been dispersed already. You know, we have 9,000 homes in the neighborhood and 23 people showed up for this. Kind of silly. We're not doing enough to educate people that it's important. So just that as an aside, but thank you for making it available. I appreciate it. So thank you. With just a brief comment on the autism thing. So as we all know, autism is now reported on a vast spectrum. So when we talk about autism as one block of thing, it could be a very, as also pointed out, it could be a very, very minor case. It could be a very major case. And that statistic is just not showing up. So the fact that we're identifying more of them is not a big surprise. It's just easy for the doctors to say, oh, yes, that's autism. So I think that would go a long way to explaining it, as well as getting help. You know, you make that diagnosis and then you get insurance to cover whatever the presumed treatments are for this sort of thing. So there's that. Glad you guys did the rabies clinic. Thank you very much. Congratulations on winning the award. Appreciate that. Good work. And thank you for letting us know about the Tai Chi and yoga at Flat Rock. I didn't know about that, and it's cool. So thank you there. That's about it for today. Thank you very much. Appreciate you guys.
Yeah. Thank you.
Is there any other public comment this evening? We need a mo-
No,
I'm sorry?
No, there's no other public comment.
We'll need a motion in a second to close the meeting. Public comment.
Second.
Ms. Bostic,
Yes.
Ms. Rubin,
Yes.
Dr. Sattler,
Yes.
Dr. Solomon, Dr. Sofer,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis.
Yes.
The Open Public Meetings Act of the State of New Jersey permits the exclusion of the public from discussions of employment matters. And we would excuse all non-members for that. We need a motion and a second to go into closed meeting.
Ms. Bostic,
Yes.
Ms. Rubin, Dr. Sattler, Dr. Solomon,
Yes.
Dr. Sofer,
Yes.
Mr. Tenzer,
Yes.
Ms. Davis.
Yes.
That is my cue. Everybody, good night.
Good night.
Catch you at the next one. Take care.
Having a mouse is so much easier.
Just